Hello, everyone. Welcome to yet another video of Study Nursing by Sense Goals. Today, in this video, we are going to discuss about DHA examination, its questions and answers, and we have also included the rationale for the answers. So, before we move ahead, let me introduce you to what all are included. Like I was saying, we have the questions as well as the answer. But in this video, we will utilize the opportunity to learn about anything related to it. So it's not going to be a very long explanatory video, but I will make sure that I give you the information about any topics which could be asked for the exams, and also any of the assessments or any of the things that you could use as a nurse in your clinical scenario also. All right. And before we move ahead, let me introduce you to the channel. Some of you might have already been watching the channel to enhance your learning. And also, some of you, especially when you're preparing for licensure exams, you might be using this channel. But if you are new to it, let me introduce you this channel that we got. In here, we discuss about short notes on diseases, conditions, and also we got a couple of videos on nursing diagnosis, nursing care plans in detail, and also a number of videos on other topics that includes anatomy and physiology. So it's an all-in-all platform, I would say. So you can utilize this channel if you are a student and nurse aspirant, or if you are someone who is really looking forward to cracking your examinations such as DHA or HEART or Prometric or even NCLEX RN. All right. So that being said, let's begin the question and answer session. In the first question, we have something that is asking about the HB level in adult females. So when you try to answer, it's important that you have a clarity on the question. So please do not confuse yourself with adult or adult males or adult females. The question is really clear. It's typically asking for the female HB level. All right. So these are your clues to not to answer or look for the wrong one. Instead, you're definitely going for the right one. The answer is 12 to 16. So the amount of hemoglobin in the whole blood is expressed in grams per deciliter, that is G/dl. The normal HB level for the males is 14 to 18 gram per deciliter, whereas for the females it's 12 to 16 gram per deciliter. When the hemoglobin level is low, the patient has anemia. And if you are quite new to the field, you can also think about the rationale why males have more hemoglobin than female. All right, this is a good question for thinking. All right, so that being said, let me take you through question number two. Which is the most common site for IM injection in adults? Once again, let me take you through the strategy of examination here. Let us crack the question into multiple parts. So it's asking for the most common sites. The most common is a keyword. IM is something which you can note, and also it's asking about adults, not children. All right. So you will soon learn about why you need to have a look at the question very clearly before answering. So the answer is deltoid muscle. And if in children, the sites such as vastus lateralis and the thigh is commonly used for infants, I mean. But for the adults, the most common is the deltoid muscle. But at the same time, the common sites for intramuscular injection include the deltoid muscle of the upper arm and the gluteal muscle of the buttocks. All right. So that's why I was saying it's important to note for the key things, the key terms that they are using in the question. So I hope it's clear for you. Let's move to the next question. Which type of isolation is required for patients with tuberculosis? When you think about TB, the thing that comes to you is lung, it's an airborne disease. Is it also being caused with a droplet infection? It could be true. So let's have a look at the answer of this question. So the answer is airborne isolation. So somebody with tuberculosis, you can actually restrain the patient on an airborne isolation. At the same time, let's use this opportunity to learn about what are the other types of isolations and also what all diseases do you isolate particular patients. So, in case of contact in isolation, so as the name indicates, we make sure that the contact is not made. All right. So during the contact isolation, the staff members wear gloves and aprons when they come in contact with you. It could be in case of vomiting or diarrhea, in case of KB, salmonella, typhi, etc. All right. Let's talk about the second one, droplet infection. That includes flu, even TB, and also in case of respiratory syncytial virus. Yeah, it's a droplet infection. So it could be entering through our eyes, the retina, uh, sorry, not retina. It could be entering through the conjunctiva. It could be entering through our nose. It could also be entering through our mouth. So, in case of all these conditions, it's common that we isolate. In the airborne diseases such as measles, SARS, severe acute respiratory syndrome, chickenpox, Mycobacterium tuberculosis, airborne precautions apply to the patients known or suspected to be infected with microorganisms transmitted by airborne droplet nuclei. All right. And how about the standard isolation? So, standard isolation, in my belief, it's applicable to all each and every patient that you're taking looking after. It's as per the infection prevention control measures that we use the personal protective equipment or PPE when you're nursing or caring for any of the patients. So this is, I think, it's one of a kind of learning that you had in this question. Let's move to the next one. Which is the electrolytic imbalance that's commonly associated with dehydration. It's once again, as I was saying, it's crucial for you to learn and understand the question really well. Let's have a look at the answer here. They are asking for the most common. So if you look at the options, you could actually be thinking hyperkalemia can be an option. Hypokalemia could also be there, but natremia, or the loss of sodium is the most common one. The electrolytic imbalance occur commonly as a result of loss of electrolytes, shift of certain electrolytes, or relative changes in the concentration caused by loss of water. The common electrolyte imbalance includes hyponatremia, as we were discussing here, loss of sodium, and the sodium and potassium pump, if you remember learning it in the early anatomy classes. It's mostly in an inverse relationship. So if you lose sodium, generally you have more potassium. So um, they could actually have high potassium in case of low natremia. So that's why I was saying option A could also be something which you are thinking as an answer, because during dehydration they can have hyperkalemia because of the loss of because of the loss of sodium. And at the same time, also, we have discussed, I think it was an examination part one of DHA exam series, that we have discussed about hypokalemia in dehydration. So, in case of severe nausea and vomiting, they can actually lose potassium. So, in that case, they can have hypokalemia. All right. So, just trying to catch your attention here, we've got two options that says hyponatremia and hypernatremia, and for the potassium they have given hyperkalemia and hypokalemia. So in reality, during dehydration or cases like nausea, vomiting, or any of the clinical cases, if you lose sodium, you can have hyperkalemia or hypokalemia. These two conditions can be observed, whereas hyponatremia is not going to be an option if you have the loss of stuff from the body. All right, so I hope you understood what I was trying to say. You could also have hypophosphatemia. You could also lose phosphate. That's why you might have seen patients, especially the elderly ones, admitted with the nausea and vomiting or severe fever or any of the associated clinical conditions, being given potassium supplements, phosphate supplements, or even common salt or even sodium chloride tablets. All right. So I hope that makes sense. So let's move to question number 5. So it's an interesting question. What's the first step in CPR? So most of you might be thinking about A, B, C, I know. So before answering the question, I think it's time to answer the question. So let me show you the answer. The answer of the question would be to check the responsiveness. So if you are in haze and you typically are aware of ABC, you could actually opt for option A. That's a tricky one here. So airway, breathing, circulation, these are the things that is given in the option. If you see option A is airway, option D is breathing, deliver breathing, and option C stands for circulation compression. So if you're somebody who is thinking about ABC, you could actually go wrong for this. Whereas check responsiveness is an interesting answer, and also it's very much the answer of the question, because before you do CPR, you applying the common sense to check the response of the patient, and if the patient is not responding, then you start with airway and breathing and compression. All right, so that's much self-explanatory. So let's move to the next question here. All right, so which of the following is a sign of hypoglycemia? So if this is also something related to diabetes, is also commonest questions asked for the any of the competitive exam, whether you're preparing for the state or national or any of the abroad examinations conducted in the countries, internationally, I would say. Learning about diabetes in thorough will help you score marks in the exams. Let's move to the option answers. Yeah, I mean, you are seeing the option, so let's discuss about the answer here. The answer is shakiness. So you can relate to any of the family members in your family members having a low sugar attack or hypoglycemic attack. You can also think about any of the scenarios when you were working and your patient had the attack. So usually when they have low sugars, they have the tremors, they kind of sweat, and they typically faint or just lie back, or they become unresponsive. This is what we usually observe. So not going into the clinical or the pathophysiology about it, let's learn it in a simple way, that is shakiness. Option A and C, you could see it in the you could see those manifestation in case of hyperglycemia. So if the sugar level is too high, then they have polyuria, and if the diabetes is affecting the eyes, they could have blurred vision, and the condition where it affects the eyes is called diabetic retinopathy, isn't it? So I think that's clear for you. Let's move to the next question. What is the best way to confirm placement of an NG tube? This is a very interesting question. Still, I think at the time this video is released, it's common for all of you to find the answer. But 10 to 15 years ago, when I graduated, during that time, we had used the other options also. I don't know how at this time you would be able to contemplate, but if there is any nurses who is watching the video who is a graduate of a couple of years back or even decades back, you can try to understand what I'm saying. Let's have a look at the answer. So it's X-ray confirmation. So if you're a nurse working in your clinicals, make sure that you have a specific concrete confirmation from the treating consultant that by X-ray it's confirmed, so it's very mandatory. And then as a nurse, you can proceed to the feeding or proceed to whatsoever medication or whatsoever usage is intended. Also, as a nurse, as a daily clinical assessment, before you begin the usage of NG tube, whether it is the extraction of a gastric fluid, whether it is a medication or commencing a feed, it's important that you assess, you look for the appearance, you make sure that it's not kinked, the measurement of the NG feed, and also whether you are getting an aspirant, you are getting, when you're aspirating, if you're getting back any of the liquid. The appearance of liquid is also important to note. The appearance, whether it is clear or dusky or it's the color of the feed, etc. It's also important to assess the pH of the feed. I'm sorry, pH of the aspiration, and it should be acidic in nature. And also at the same time, when it comes to a very vulnerable patients, especially in case of patients who are under palliative or really really vulnerable, it's also important to look for any pressure ulcers, or we call it as moist medical device associated skin damage. So it's also important for you to assess all these things. So I hope it's a learning for you. It's a good thought or school of thought for you to think about all these things discussed when we are discussing the answers. All right. So we move to the next question. Which of the following medication is used to reverse opioid overdose? This is also a commonly asked question. So you can please note down the answer as naloxone. So any of the opioids used, you can give naloxone. The naloxone belongs to opiate antagonist. So the classification of this medication is, it comes under the opiate antagonist, and it works by blocking the effect of opiates to relieve dangerous symptoms caused by the high levels of opiates in the blood. And if this medication is given to people who have not taken opioids, it virtually has no effect. All right. So that's a piece of knowledge for all of us. Let's move to a next question. What is a typical dosage of aspirin for an adult with a suspected heart attack? So once again, if you're somebody preparing for an exam, it's important to note that you learn about acute topics such as basic life support, a couple of things about myocardial infarction or heart attack, some of the information about stroke, etc. So let's have a look at the answer. The answer here is 160 to 325 mg. So usually that's a loading dose. I would say it's been almost the same ever since for our period of longer years, because I have an experience of working in cardiac ICU as well as in cath lab, where we carry out angiogram, angioplasties, and all the stuff. All right, including the DSA, or the stenting of the carotid artery in the patients having uh, it mostly relates to the brain and the circulation. So I'm not going on to all these things in detail, but as a nurse who has worked with them, I could say in acute myocardial infarction and during the acute occlusive stroke, a loading dose of 162 to 325 mg of aspirin is necessary to achieve a rapid clinical anti-thrombotic effect. All right. And also, when we are discussing this question, it's interesting to note that it is usually accompanied by clopidogrel. So, when you have a patient with coming with heart attack, whether it could be ST elevation MI or non-ST elevation MI, whether the patient is for angioplasty, all right, when you have a patient there, you have a loading, something called as a loading dose, and it actually usually comprises of aspirin and clopidogrel. And clopidogrel, they could actually the doctors could actually order for 300 to 600. So sometimes you could receive a patient who's coming from another facility, and they might have actually given a thromboembolic agent that includes streptokinase or tenetoplase or something like that. Okay. In case of that, they could have variation. The patient will not be needing that much clopidogrel. So in that case, they would ask you to load with the minimal. So it depends. But in general, I would say 160 to 325 mg of aspirin, and usually it's 300 to 600 clopidogrel in case of angioplasty, in conjunction with of course, with aspirin we are speaking about. So this is another piece of knowledge who those for those who are not coming from a cardiology background. The things we discussed is purely based on the clinical experience, but let me know in the comments if they have changed, or if you have had any other situation where you have administered a different dose and why was it. All right. So let's move to the next question, which asks for the hospital acquired infection. We have done a very short video on hospital acquired infection. I would really recommend that you all go and watch it. It's a very simple one. You don't need to actually go into detail for all these options that is given, but it's really interesting one. I will try to give the link of the video at the end of the quiz here. The answer of the most common cause of nosocomial infection or hospital acquired infection is COTI, or we say catheter associated UTI. Or imagine if you're not having COTI here, if they have given urinary tract infection, you can choose urinary tract infection, UTI. It's the most common cause of nosocomial infection. Have a look in the short note what the other option are also like. Well, all of these options given belongs to the most common hospital acquired. Sorry, the common hospital acquired infection, but among them, option D, COTI, is the most commonly found infection. All right, so it's quite tricky if you have enough knowledge and then you know about all these things and you're thinking, oh, all of these options are the answers, and what is the most common one? All right, so let's move to the, I think it's going to be the last question. So the last question here: which of the following is a sign of septic shock? So we have got a couple of symptoms or manifestations here. Once again, just like we discussed about heart attack or stroke, it's interesting to note that you can have a look at what septic shock is, what are the management, what are the clinical signs, etc. But if you're in a hurry, you don't have much time, let me tell you in a very short term that septic shock is a life-threatening condition that happens when your blood pressure drops to a dangerously low level after the infection. So septic shock, low BP, and since you have the low BP, you look for any of the symptoms here. So any of the patient having low BP, you can assume that they have hypotension as well as bradycardia, because the heart should be pumping less, isn't it? But no, in order to compensate, your heart tries to beat fast, and in that case you can have tachycardia in septic shock in the earlier stages. So in the failure stage, you may have bradycardia, but you typically have hypertension and tachycardia during septic shock. So hypertension is a symptom. If you ask me what are the other symptoms, a patient could have chills, confusion, delirium, fever, or low temperature, hypothermia or hypothermia, lightheadedness due to low blood pressure, rapid heartbeat, which is tachycardia, skin rash or mottled skin, and warm skin. All right. So these are the common symptom of septic shock. All right. So with this, we have completed um, 10 questions that are common for the exams. We have also come across some of the related discussions of these diseases. I hope it's useful for you if you're somebody planning to a word from the social media and use 20 to 30 minutes every day to enhance your knowledge and to become a successful nurse, or if you're somebody who is really really looking forward to cracking exams in a serious way, you can subscribe to the channel and make sure that you're watching the newly released video. Also, it could be a drug study, it could be a short note, it could be a nursing care plan or nursing diagnosis. But we are at the moment mostly concentrating on active advancement rather than general topics. So whichever topic we release would be of high importance, I would say. So with that, I wish you all the very best, and thank you so much for the time and dedication that you have had until this time, that you were able to have a look at all the questions. Once again, wishing you all the very best.